What if I told you that your feet are trying to warn you right now about a silent killer that affects over 500 million people worldwide? And the scariest part is that most of these people do not even know they have it yet. They are walking around every single day with dangerously high blood sugar, and their body is desperately sending them signals. Those signals are showing up right there on their feet. But because nobody ever taught them what to look for, they ignore it completely. They dismiss it. They cover their feet with socks and shoes and move on with their day. And that decision, that small moment of dismissal, can cost them everything. I have been a physician for many years, and I have sat across from patients who lost toes, who lost feet, who lost legs, and every single one of them told me the same thing. They said the signs were there. They felt something was off, but they did not know what it meant, and nobody told them. That is exactly why I am making this video today, because the knowledge I am going to share with you in the next 28 minutes has the power to change your life, or the life of someone you love. Today, I am going to walk you through every single warning sign that your feet may be showing you right now. I'm going to explain in plain language what is happening inside your body when each of these signs appears. And most importantly, I am going to tell you exactly what you can do about it starting today. Because the earlier you catch this, the more you can reverse, and the more of your health you can protect. I am Dr. Calara, and welcome to Health Hub, where we give you real medical knowledge to protect yourself and your family. Every week, we break down complex health topics into clear, honest information you can actually use. If you are not subscribed yet, please do that right now before we go any further, because the information in this video is far too important to lose track of. And please stay with me all the way to the end, because sign number 7 is the one most doctors forget to tell their patients about, and it could save your life. Before we look at the signs, you need to understand why the feet are the first place blood sugar damage shows up. This is not random, and it is not a coincidence. It is pure biology. When your blood sugar stays elevated for long periods of time, it begins attacking two of the most important systems in your body. The first is your nervous system. Specifically, the peripheral nerves, the ones that travel the longest distances from your spinal cord all the way down through your legs and into your toes. The second system it attacks is your blood vessel network, starting with the smallest, most delicate vessels called capillaries that deliver blood to your extremities. Your feet are the farthest point from your heart. Think of your circulation like a river system. The heart is the source, and the blood vessels are the rivers and streams carrying blood to every part of your body. Your feet are at the very end of the most distant tributaries. So when the flow starts to weaken, when the vessels start to narrow and stiffen from years of high blood sugar exposure, the feet feel it first. When the nerves start to break down, the longest nerves going to your feet break down first, simply because they have the most surface area exposed to the damage. This nerve damage has a medical name. It is called diabetic peripheral neuropathy, and it is one of the most common and most serious complications of diabetes. Research shows that more than half of all people with diabetes will develop some degree of this condition during their lifetime. And here is the part that truly concerns me as a physician. Many people already have significant nerve damage by the time they receive their official diabetes diagnosis. This means years of silent damage happened before anyone caught it. Years of high blood sugar quietly destroying nerve fibers and narrowing blood vessels without any obvious warning that most people would recognize. This is exactly why what we are covering today matters so much. Your feet have been quietly accumulating these signs, and they are ready to show you what is happening if you know how to look. So I want you to be honest with yourself as we go through each sign. And if you recognize something, do not be afraid. Be grateful that you are seeing it now, because now you can do something about it. The first sign is tingling in the feet. Most people describe it as a pins and needles sensation, similar to when your hand falls asleep. Some people say it feels like a mild buzzing or a low-level electrical current running through their toes or the sole of the foot. This tingling is happening because the protective coating around your nerve fibers, called the myelin sheath, is being damaged by high blood sugar. Think of it like the rubber insulation around an electrical wire. When that insulation wears away, the wires start sending signals erratically, causing interference and sparks. When the myelin sheath around your nerves breaks down, your nerves start firing incorrectly, and you feel that as tingling. Now, every person has experienced the temporary pins and needles that come from sitting in an awkward position. That is completely normal, and it goes away quickly when you change positions. What I am describing is something different. A tingling that comes on without any obvious cause. A tingling that you notice regularly, perhaps several times a week or every night. A tingling that seems to live in your feet and does not fully go away. If you have been experiencing that for weeks or months, your nerves are sending you a distress signal. Get your blood sugar tested. Do not dismiss this as just getting older. The second sign is numbness, and I need you to understand that numbness is actually more dangerous than tingling. Here is why. When you experience tingling, your nerves are still trying to talk to you. They are sending signals, even if those signals are scrambled. When numbness sets in, it means the lines of communication are going silent. The nerves are so damaged that they can barely send any signal at all. And that creates a situation that is genuinely life-threatening if it goes unmanaged. When you cannot feel your feet, you become completely unaware of injury. You might step on a nail and keep walking. You might wear a shoe that is slightly too tight and develop a blister you never feel forming. You might brush your foot against something hot and not pull away in time. All of these small injuries, which in a healthy person would cause immediate pain and immediate protective action, happen silently in someone with neuropathy. And those silent injuries become wounds. And those wounds, in a body with poor circulation and a weakened immune response from high blood sugar, do not heal. They deepen. They become infected. They become ulcers. Diabetic foot ulcers are the leading cause of non-traumatic amputations in the world. Not car accidents, not industrial injuries, wounds that started small and were never felt. That is the reality of what untreated diabetic neuropathy leads to. So please do a simple check right now if you can. Have someone very gently touch different parts of your foot with something soft. The toes, the ball of the foot, the arch, the heel, between the toes. Are there any spots that feel less sensitive than others? Any areas that feel oddly muted or different? If yes, please see your doctor this week and describe exactly what you found. The third sign is a burning pain in the feet, particularly one that gets worse when you are resting or lying down at night. This confuses people because they think if nerves are damaged, they should feel less pain, not more. But diabetic neuropathy is complicated. Different types of nerve fibers are affected differently. Some become underactive, producing numbness. Others become overactive and start firing pain signals randomly, even when there is nothing physically wrong with the foot. The result is a burning, aching, sometimes stabbing pain that has no obvious external cause. The reason it intensifies at night is simple. During the day, your brain is flooded with information. Sounds, conversations, tasks, movement, sensations from your whole body. All of that competes with the pain signals coming from your feet. But at night, when the room is quiet and dark and your body is still, the pain signals have no competition. They become the loudest voice in your nervous system. Many of my patients tell me this burning pain at night was the moment they first knew something was seriously wrong. Some of them had been having mild burning sensations for months, but convinced themselves it was nothing. It was only when it started waking them up at 2 and 3 in the morning that they finally came to see me. Do not wait for that level of disruption to seek help. If you regularly feel a burning, aching, or uncomfortable sensation in your feet when you are resting, especially at night, that is your body asking you for help. Listen to it. The fourth sign involves the appearance of the skin on your feet. Look at your feet right now if you can. The skin of someone with prolonged high blood sugar often becomes extremely dry, rough, and prone to cracking. The heels are often the most affected area. You might see thick, flaky skin that peels. You might see deep cracks in the heel skin that sometimes bleed. In other areas, particularly over the tops of the feet and the toes, the skin might look shiny, tight, and thinned out as if it has been stretched. These changes happen because high blood sugar dehydrates the body at a cellular level through a process called osmosis. The moisture is essentially pulled out of the skin cells. At the same time, the nerves that control the sweat glands in your feet stop working properly, so your feet stop sweating normally, making the dryness even worse. And reduced circulation means the skin is not receiving the nutrients it needs to stay healthy and resilient. The combination of all three of these factors, cellular dehydration, loss of sweat gland function, and reduced circulation, produces skin that is fragile, dry, and prone to breaking down. Those cracked heels that look like a simple cosmetic problem are actually one of the most dangerous things I see in diabetic patients. A crack in the heel is an open door for bacteria. Once bacteria enter through that crack into tissue that already has poor blood flow and a weakened immune response, an infection can establish itself very rapidly. Small cracks become infected wounds. Infected wounds become ulcers. This is a progression I have watched happen many times, and it is entirely preventable with the right knowledge and the right daily habits. The fifth sign is a change in the color of your feet. Healthy feet should be a relatively consistent, normal skin tone. When the blood supply is being damaged by high blood sugar, you start to see colors that should not be there. Patches of redness, particularly around the toes and the ball of the foot, can indicate inflammation or early infection. Sometimes this redness is warm to the touch. A bluish or purplish discoloration of the toes or the foot is called cyanosis, and it means the tissue is not receiving enough oxygen-carrying blood. This is a serious sign of vascular compromise. The most alarming thing you can see is darkening or blackening of the skin, especially in the toes. If you see a toe or area of the foot turning gray, dark brown, or black, this is a medical emergency without any exaggeration. This discoloration indicates that the tissue is dying because blood supply has been cut off completely. This is gangrene. Gangrene does not resolve on its own. It spreads to healthy tissue, and when it is caught at this stage, the usual outcome involves amputation of the affected area. I am sharing this not to frighten you, but because I want you to understand that if you ever see this on yourself or someone you love, you need to call emergency services immediately. Time matters enormously at that point. The sixth sign is poor wound healing. This is one of the most reliable indicators of blood sugar problems, and it is one that you can assess simply by reflecting on your own experience. Think about the last time you had a small cut or scrape or blister on your foot. How quickly did it heal? In a person with healthy blood sugar, good circulation, and a fully functioning immune system, a small wound typically closes and heals within a week or so. If you find that wounds on your feet take 2 weeks, 3 weeks, or longer, if they seem to plateau and stop improving, if they are getting larger instead of smaller, or if they are accompanied by discharge or odor, these are serious red flags. High blood sugar impairs wound healing through several mechanisms at the same time. It reduces the ability of immune cells to reach the wound and fight infection. It damages the blood vessels that need to deliver nutrients and oxygen for tissue repair. It impairs the production of collagen, which is the protein scaffold that rebuilds damaged tissue. The net effect is that even a very minor wound can become a major medical problem very quickly in someone whose blood sugar is not well controlled. Any wound on your foot that is not clearly and steadily improving within a few days deserves medical attention. Do not wait and see. Act. The seventh sign is swelling of the feet and ankles, and I call this the forgotten sign because it is so often attributed to other causes. People think their feet are swollen because they were on their feet all day, or because of the heat, or because of a long flight. And while those things can cause temporary swelling, the kind of persistent swelling that I am talking about, swelling that is there when you wake up in the morning before you have even been on your feet, swelling that comes back every single day, swelling that leaves sock marks around your ankle that take hours to fade. That kind of swelling is telling a different story. Chronic high blood sugar damages the kidneys over time. The kidneys are responsible for filtering the blood and managing the balance of fluid throughout the body. When kidney function is compromised, the body retains excess fluid, and that fluid accumulates in the tissues. Because of gravity, it tends to collect first and most heavily in the lowest part of the body, which is the feet and ankles. Additionally, damaged and leaky blood vessels allow fluid to seep out into the surrounding tissue, adding to the swelling. If you press your finger into the swollen flesh of your ankle and hold it for several seconds, then release it, and the indent stays visible for more than a few seconds, this is called pitting edema, and it requires medical evaluation without delay. The eighth sign is foot odor that persists despite good hygiene. This surprises most people because we associate foot odor with not washing properly. But when someone with high blood sugar develops persistent foot odor even while maintaining good hygiene, it almost always signals an active infection, either bacterial or fungal. High blood sugar suppresses the immune system's ability to fight off these organisms. It creates an environment where bacteria and fungi can thrive because blood sugar literally feeds them. Reduced circulation means the natural immune response cannot reach the infected area efficiently. Fungal infections are particularly common. Athlete's foot, which is a fungal infection of the skin between the toes, recurs far more frequently in people with diabetes than in the general population. Nail fungus, which causes the toenails to thicken, discolor, and crumble, is also significantly more common. Bacterial infections can develop under the nails or in the skin of the feet. Look for white or yellowish buildup under the toenails, skin between the toes that is persistently soft, white, or peeling, redness around the nail edges, or any area of skin that looks infected. These infections need treatment because, in a person with compromised immunity and poor circulation, they can escalate very rapidly. The ninth sign is the loss of hair on the lower legs and feet. This is a sign that most people have never heard associated with blood sugar, and many physicians do not mention it either. But it is actually a well-documented indicator of peripheral arterial disease, which is a serious vascular complication of long-term high blood sugar. Look at your lower legs and the tops of your feet right now. Most adults have at least some hair in these areas. If you have noticed over time that the hair on your lower legs has been thinning or has disappeared, if the tops of your feet look smooth and hairless compared to how they used to look, this is because the blood supply to those areas has become insufficient to sustain hair follicle activity. Hair follicles are very sensitive to blood supply. When circulation is compromised, the follicles stop producing hair. The skin may also feel cooler than the skin on the upper leg. The feet may appear slightly paler than they should. Pressing on the toenails and releasing may cause them to take longer than normal to regain their pink color. All of these together are signs of peripheral arterial disease, a condition that dramatically increases the risk of serious foot complications and that requires medical management. The 10th sign is a change in the actual shape of the foot. This is the most severe sign on our list, and it goes by the medical name Charcot foot. When the nerves in the foot have been severely and progressively damaged, the muscles that maintain the structure and alignment of the foot lose their ability to function correctly. Without proper muscular support, the joints and bones of the foot begin to shift. The arch can collapse. Bones can fracture from normal walking pressure and never fully heal because the person cannot feel the fractures happening. Over time, the foot takes on a deformed appearance. The arch flattens completely. The bottom of the foot may develop a rounded bulge, giving it a rocker bottom shape. What makes Charcot foot so insidious is that it can develop with very little pain, because the nerves that should be screaming in pain are already too damaged to function. People walk on fractured, dislocated feet for months sometimes, experiencing only mild discomfort they attribute to tired muscles or getting older. By the time the deformity is obvious, significant structural damage has already occurred. If you notice that the shape of your foot looks different than it used to, if there is a new area of the foot that appears swollen and warm without any obvious injury, or if the bottom of your foot no longer has a normal arch, please see a doctor immediately and describe specifically what you are observing. Now I want to talk about what you should do with all of this information. The most important first step is to find out your blood sugar status if you do not already know it. If you have a glucometer at home, test your fasting blood sugar first thing in the morning before eating or drinking anything except water. A reading above 126 milligrams per deciliter on 2 separate mornings indicates diabetes. A reading between 100 and 125 indicates pre-diabetes, which is already causing changes in your body and needs to be addressed. A reading above 200 at any time of day is an urgent situation that needs same-day medical attention. If you do not have a glucometer, call your doctor today and request a blood test. Ask specifically for an HbA1c test. This test does not require fasting and gives you the average blood sugar level over the past 2 to 3 months, which is much more informative than a single reading. An HbA1c below 5.7 is normal. Between 5.7 and 6.4 means pre-diabetes. At 6.5 or above, the diagnosis is diabetes. Knowing your number gives you the power to act. Starting today, make foot inspection a daily habit. Every evening before bed, take off your socks and look carefully at both feet. Use good lighting. Check every surface. Look for any new cuts, blisters, or areas of broken skin. Check the color of your toes and skin. Feel for any areas that seem swollen or warm. Look at your nails for any changes in thickness or color. Check between every toe. This takes less than 2 minutes, and it can catch a developing problem before it becomes a serious one. On the dietary side, the single most impactful change you can make immediately is to sharply reduce refined carbohydrates and added sugars. White rice, white bread, pasta, sugary beverages, commercial pastries, candies, and highly processed snack foods all cause rapid and significant spikes in blood sugar. Replacing these with vegetables, proteins, healthy fats, nuts, and fiber-rich foods produces measurable improvements in blood sugar levels within a matter of weeks. You do not have to overhaul everything at once. Start by eliminating sugary drinks completely. Replace white rice with cauliflower rice, or reduce your portions significantly. Add 1 extra serving of vegetables to each meal. These small changes compound over time into significant results. Physical activity is medicine for blood sugar. When your muscles are actively working, they absorb glucose directly from the bloodstream without needing insulin, which means exercise lowers blood sugar immediately during and after activity. A 20 to 30-minute walk every day is genuinely one of the most powerful interventions for blood sugar control that exists. It costs nothing, it requires no equipment. You can start today. If walking is difficult for you, even gentle seated leg exercises or swimming or cycling can provide significant benefit. For your feet specifically, protect them every day as if your life depends on it. Because in some ways, it does. Never go barefoot. Not inside the house, not on the beach, not anywhere if you have any signs of reduced sensation. Moisturize your feet daily after bathing, but keep the lotion away from between the toes, where trapped moisture encourages fungal growth. Wear shoes that fit properly, with plenty of room in the toe box and no areas of pressure. Check inside your shoes before putting them on each time. Trim your toenails straight across, not curved, to prevent ingrown nails. And if you ever see any wound on your foot that is not healing within 2 to 3 days, see a doctor. Do not manage it yourself. Do not wait. I want to close by speaking to you directly and honestly. If you recognized several of the signs I described today, please do not let that recognition become fear that paralyzes you. Let it become fuel that motivates you. The research on this is genuinely hopeful. People who bring their blood sugar under control through diet, exercise, and appropriate medical care can stop the progression of nerve damage. In many cases, they experience meaningful recovery of nerve function. Circulation improves when the vascular system is no longer under constant assault from high blood sugar. Wounds heal. Infections resolve. The body has an extraordinary capacity to recover when we support it properly. The people who face the worst outcomes are the ones who saw the signs and waited. The people who do the best are the ones who saw the signs and acted. You now have the knowledge to act. Your feet have been trying to tell you something. Now you know how to listen. Now you know what those signals mean. And now you know exactly what to do. Please do not let this information stay in this video. Share it with your parents, your siblings, your friends, anyone over 40 in your life who might not know what to look for. The person you share this with might be the person whose limb is saved because they saw it in time. Thank you so much for watching all the way through today. I know this was a lot of information, and I am genuinely grateful for your trust. If this video helped you, please give it a like and leave a comment below telling me which sign was the one you had never heard of before. Subscribe to Dr. Calara Health Hub so you never miss a video, because every single week, we bring you this kind of clear, honest, doctor-backed health knowledge. I am Dr. Calara, and I will see you in the next video. Take care of your health because no one else will do it for you.